You went to bed at 10 p.m. last night. You slept for 8 full hours. No one woke you up. You didn't get up multiple times to use the bathroom. By every measure, you should have gotten a full night's rest. And yet, when your alarm went off this morning at 6 a.m., you felt exactly as exhausted as you did when your head hit the pillow. You dragged yourself out of bed, you made your coffee, and by 9 o'clock or 10 o'clock in the morning, you still felt like you could go back to sleep. Not because you didn't sleep enough hours, but because something about the quality of that sleep left you feeling like you'd been awake all night. You tell yourself, I'm just getting older. This is normal at my age. Your friends say the same thing. Everyone over 60 seems to accept waking up tired as an inevitable part of aging. But here's what almost nobody tells you, and what your doctor probably hasn't screened for. Waking up exhausted despite adequate sleep hours is not normal aging. It's a warning sign. And in many cases, it's pointing to a silent, life-threatening condition that affects nearly 40% of adults over 65, but remains undiagnosed in the vast majority. I'm talking about obstructive sleep apnea. And I'm talking about the fact that while you think you're sleeping peacefully through the night, your breathing may be stopping dozens, sometimes hundreds of times. Your oxygen levels may be dropping dangerously low. Your brain may be waking up repeatedly, microaerosols you don't consciously remember, yanking you out of deep, restorative sleep and leaving you chronically exhausted no matter how many hours you spend in bed. My name is Dr. Scott Franklin, and over the past 2 decades working with patients in their 60s, 70s, and 80s, I've seen the same devastating pattern repeat itself over and over. Someone complains of fatigue. They're told it's just aging. Months or years go by. Then they have a stroke or a heart attack, or they're diagnosed with treatment-resistant high blood pressure. And when we finally do a sleep study, we discover they've had severe sleep apnea the entire time, silently destroying their cardiovascular system while everyone dismissed their exhaustion as normal. A landmark study published in the Journal of the American Medical Association followed over 6,000 adults aged 65 and older for an average of 8 years. The researchers found that those with untreated moderate to severe sleep apnea had a 46% increased risk of death from any cause compared to those without sleep apnea. They had double the risk of stroke. They had significantly higher rates of heart failure, atrial fibrillation, and cognitive decline. 46% increased risk of death, double the stroke risk. And most of these people had no idea they had the condition. So in the next 20 minutes, I'm going to walk you through the 8 warning signs that your chronic fatigue isn't normal aging, it's sleep apnea. I'm going to explain exactly what's happening to your body during the night, why this condition becomes more dangerous after 60, and most importantly, what you need to do to get diagnosed and treated before it causes irreversible damage. But right now, before we go any further, I need to know who I'm talking to. Drop a comment below and tell me, do you wake up feeling tired even after a full night's sleep? Just yes or no. Your answer is going to help me understand how many people are dealing with this right now. Let me give you the critical framework for understanding what sleep apnea is and why it becomes so much more common and more dangerous after age 60. Sleep apnea is a condition where your upper airway, the passage from your nose and mouth down to your lungs, repeatedly collapses during sleep, completely or partially blocking airflow. When this happens, you stop breathing. Your oxygen level drops. Your brain sends a panic signal that briefly wakes you just enough to reopen the airway. You gasp, you breathe again, and then you fall back asleep. This cycle can repeat 5, 10, 30, even 60 or more times per hour throughout the entire night. Most people have no conscious memory of these events. They think they slept through the night, but their brain never achieved deep restorative sleep because it was being repeatedly jolted into a state of alarm. Here's what changes after age 60 that makes sleep apnea more likely and more severe. First, the muscles in your throat and tongue naturally lose tone with age. During sleep, when all your muscles relax, weakened throat muscles are more likely to collapse and obstruct your airway. Second, many people gain weight with age, particularly around the neck. Extra tissue in the neck area narrows the airway and makes obstruction more likely. Third, changes in hormone levels after menopause in women remove a protective effect that estrogen provides against airway collapse. And fourth, the use of sedating medications, muscle relaxants, pain medications, or alcohol, all of which become more common with age, further relax the throat muscles and worsen airway obstruction. Now, here's why untreated sleep apnea is so dangerous for your cardiovascular system. Every time you stop breathing, your oxygen level drops. Your body interprets this as a life-threatening emergency. It releases a surge of stress hormones, adrenaline and cortisol. Your heart rate spikes, your blood pressure shoots up. Your blood vessels constrict. This happens not once, but potentially hundreds of times per night, every single night, for months or years. The cumulative effect is devastating. Your cardiovascular system is under constant assault. Blood pressure becomes chronically elevated. The lining of your blood vessels becomes damaged. Your heart muscle thickens and weakens. Your risk of arrhythmias, particularly atrial fibrillation, increases dramatically. And your risk of stroke and heart attack rises exponentially. A comprehensive study in the New England Journal of Medicine found that people with severe untreated sleep apnea had a threefold increased risk of stroke and a twofold increased risk of sudden cardiac death compared to those without sleep apnea. 3 times the stroke risk, twice the sudden death risk, and most people suffering from this don't know they have it because the symptoms are dismissed as normal aging. That's the framework. Now let me show you the warning signs. Before we continue, tell me your name and where you're watching from. I read every comment and I'd love to know who I'm helping today. Warning sign number 1. Waking up with a headache, particularly at the base of your skull. Let's start with one of the most common but least recognized symptoms of sleep apnea, morning headaches. You wake up and immediately feel a dull, throbbing headache. It's not a migraine, it's not severe, but it's there, usually at the back of your head or the base of your skull. You take some ibuprofen or acetaminophen. Within an hour or two, the headache fades. You assume you slept in an awkward position or you're dehydrated. But here's what's actually happening. During episodes of sleep apnea, when your oxygen drops and carbon dioxide builds up in your bloodstream, the blood vessels in your brain dilate in an attempt to increase blood flow and oxygen delivery. This dilation causes increased pressure inside your skull, which you experience as a headache. The headache is worse in the morning because that's when the cumulative effect of a night's worth of oxygen desaturations is at its peak. As you're awake and breathing normally, oxygen levels normalize, carbon dioxide clears, blood vessels return to normal size, and the headache resolves. Research published in the journal Headache found that morning headaches occurred in over 50% of people with moderate to severe sleep apnea, but in less than 15% of people without sleep apnea. Here's the pattern. The headache happens almost every morning. It's present when you first wake up. It improves within 1 to 2 hours of being awake, and it's often accompanied by other symptoms on this list. If you're experiencing this pattern, your headache isn't from your pillow, it's from oxygen deprivation during sleep. Warning sign number 2. Waking up with a dry mouth or sore throat. Here's another symptom that seems completely benign but is actually a major red flag. Waking up every morning with a severely dry mouth, a parched throat, or a sore throat. The reason this happens is simple. When your airway is partially or completely blocked during sleep apnea episodes, you unconsciously open your mouth wider trying to get air. You begin breathing through your mouth instead of your nose. By morning, your mouth and throat are completely dried out. Additionally, many people with sleep apnea snore loudly. The vibration of tissues during snoring causes throat irritation and soreness. The combination of dry mouth, sore throat, and feeling like you haven't had any moisture in your mouth all night is classic for sleep apnea. A study in the Journal of Clinical Sleep Medicine found that chronic dry mouth on awakening was reported by 68% of sleep apnea patients compared to only 22% of people without the condition. If you're keeping a glass of water by your bed and drinking it immediately every morning because your mouth is so dry, that's not just normal nighttime dehydration. That's a warning sign. If you're still with me and finding these symptoms familiar, take 2 seconds and type the number 2 inches in the comments. Let's keep going. Warning sign number 3. Your partner says you snore loudly, or they've heard you stop breathing. This is the warning sign that most people are aware of, but it's worth emphasizing because it's the most specific indicator. Loud, disruptive snoring, particularly snoring that's punctuated by periods of silence followed by gasping or choking sounds, is the hallmark of obstructive sleep apnea. Here's what your partner is hearing. You're snoring because air is forcing its way through a narrowed airway. Then suddenly, the snoring stops completely because your airway has fully collapsed and no air is moving. There's silence for 10, 20, sometimes 30 seconds. Then you gasp, your airway reopens, and the snoring resumes. If your partner has told you, you stopped breathing at night, or I've had to shake you because you weren't breathing, that is not something to laugh off. That is a medical emergency happening repeatedly every single night. A study published in Sleep Medicine Reviews found that witnessed apneas, episodes where a bed partner observes the person stop breathing, were present in over 85% of people ultimately diagnosed with moderate to severe sleep apnea. Now here's the problem. Not everyone has a bed partner to witness these events. If you sleep alone, You may have severe sleep apnea and have no idea because there's no one to tell you what's happening. That's why the other symptoms on this list are so important. They're the clues your body is giving you directly. Warning sign number 4, waking up frequently to urinate, nocturia. Here's one that surprises most people. Waking up multiple times per night to urinate can be a symptom of sleep apnea, not just a bladder or prostate problem. Here's the mechanism. When you experience apnea episodes and your oxygen drops, your heart responds by releasing a hormone called atrial natriuretic peptide, or ANP. This hormone tells your kidneys to produce more urine. Your body is essentially trying to reduce blood volume to decrease the strain on your heart during these oxygen deprivation events. The result? You produce more urine during the night than normal, and you wake up repeatedly needing to use the bathroom. Research in the journal Urology found that patients with sleep apnea had significantly higher rates of nocturia, and when the sleep apnea was treated with CPAP therapy, nighttime urination frequency decreased dramatically in most patients. Here's the pattern. You're waking up 2, 3, or more times per night to urinate. You assume it's your prostate if you're male, or weak bladder if you're female. You might even be taking medication for overactive bladder, but the medication doesn't help much because the problem isn't your bladder. It's your sleep apnea triggering excess urine production. If nocturia is accompanied by other symptoms on this list, particularly snoring or morning headaches, sleep apnea needs to be ruled out before attributing everything to the bladder. Warning sign number 5, difficulty concentrating and memory problems during the day. Let's talk about the cognitive effects of sleep apnea, because they're profound and often mistaken for early dementia. When your brain is repeatedly deprived of oxygen during the night and never achieves deep restorative sleep, several things happen. First, your brain doesn't consolidate memories properly. Deep sleep is when your brain transfers information from short-term to long-term memory. Without adequate deep sleep, that process is disrupted. Second, chronic oxygen deprivation causes actual structural changes in the brain. MRI studies have shown that people with untreated sleep apnea have measurable loss of gray matter in regions of the brain responsible for memory and executive function. Third, the constant state of fatigue and sleep deprivation impairs your ability to focus, concentrate, and process information during waking hours. The result looks exactly like early cognitive decline. You forget things. You lose your train of thought mid-sentence. You struggle to concentrate on tasks that used to be easy. You feel mentally foggy. Family members notice. They worry about dementia. But the underlying cause is sleep apnea, and it's potentially reversible with treatment. A study in the Journal of the American Geriatric Society found that older adults with untreated sleep apnea had cognitive test scores equivalent to people 7 to 10 years older than their actual age. But when treated with CPAP, cognitive function improves significantly within weeks to months. If your memory and concentration have declined noticeably over the past year or two, and you have other symptoms on this list, get a sleep study before assuming it's Alzheimer's. Now, before I show you the next warning sign, if this information is connecting dots for you, hit that like button and tell me in the comments, have you been experiencing memory problems that you've attributed to just getting older? I want to hear your stories. Warning sign number 6, high blood pressure that's difficult to control despite medication. Here's a warning sign that's often completely overlooked. Resistant hypertension. High blood pressure that remains elevated despite taking 2 or 3 blood pressure medications. Sleep apnea is one of the most common causes of resistant hypertension. The repeated nighttime surges in blood pressure caused by apnea episodes train your cardiovascular system to operate at a higher baseline pressure even during the day. Your doctor increases your medication, adds a second drug, adds a third. Your blood pressure improves somewhat but never fully normalizes. Meanwhile, nobody has checked whether sleep apnea is the underlying cause keeping your pressure elevated. Research published in Hypertension found that approximately 70% of patients with resistant hypertension have obstructive sleep apnea. When the sleep apnea is treated, blood pressure often decreases significantly, sometimes allowing reduction in the number or dose of medications needed. If your blood pressure has been difficult to control, if you're on multiple medications and your doctor keeps adjusting doses or adding new drugs, ask about a sleep study. Treating the sleep apnea may be the key to finally getting your blood pressure under control. Warning sign number 7, falling asleep during the day, especially while sitting quietly. Excessive daytime sleepiness is one of the cardinal symptoms of sleep apnea. This isn't just feeling a little tired. This is overwhelming sleepiness that makes you fall asleep during activities. You're watching television and you doze off. You're reading a book and you can't keep your eyes open. You're sitting in a waiting room and you fall asleep. In severe cases, people fall asleep during conversations or even while driving. This level of sleepiness is dangerous. It impairs your ability to function safely. It dramatically increases your risk of car accidents, falls, and injuries. A study in the American Journal of Respiratory and Critical Care Medicine found that people with untreated sleep apnea had a 7-fold increased risk of motor vehicle accidents compared to those without sleep apnea. If you're struggling to stay awake during normal daytime activities, that's not laziness. That's not just needing more coffee. That's your body telling you that your sleep quality is so poor that you're not getting the rest you need, and sleep apnea is a likely culprit. Warning sign number 8, waking up gasping or choking. Finally, let's talk about the most dramatic and frightening symptom, waking up suddenly in the middle of the night, gasping for air or feeling like you're choking. This happens when an apnea episode is severe enough or lasts long enough that your brain jolts you fully awake in a panic. You wake up abruptly, heart racing, gasping, feeling terrified. After a minute or two, you catch your breath, your heart rate settles, and you fall back asleep. You might dismiss it as a bad dream or anxiety, but what actually happened is that you stopped breathing long enough that your brain initiated an emergency wake-up to save your life. If this is happening to you, even occasionally, you have sleep apnea. This is not something to wait and see about. This requires immediate evaluation. Here's what I need you to take away from this entire video. If you have 2 or more of these warning signs, you need a sleep study. Not eventually, not if it gets worse. Now, step 1, talk to your primary care doctor. Use this exact language. I'm experiencing chronic fatigue despite adequate sleep hours, along with list your specific symptoms, morning headaches, snoring, witnessed apneas, nocturia, etc. I'm concerned about obstructive sleep apnea, and I need a referral for a sleep study. Step 2, get a sleep study. There are 2 types. In-lab polysomnography. You spend the night at a sleep center hooked up to monitors. This is the gold standard and provides the most comprehensive data. Home sleep test. You take equipment home and sleep in your own bed while it monitors your breathing, oxygen levels, and heart rate. This is more convenient and less expensive, but provides less detailed information. Your doctor will recommend which is appropriate for you based on your symptoms and medical history. Step 3. If you're diagnosed with sleep apnea, the primary treatment is CPAP, continuous positive airway pressure. This is a machine that delivers pressurized air through a mask you wear during sleep. The air pressure keeps your airway open, preventing collapse. I know what you're thinking. I don't want to sleep with a machine. I don't want to wear a mask. I understand. But here's what I need you to hear. CPAP therapy is life-changing for most people who use it consistently. Within days to weeks, you'll notice you wake up feeling rested for the first time in years, morning headaches disappear, energy returns, memory and concentration improve, blood pressure decreases, nighttime urination frequency drops. The benefits are profound and immediate for most people. Other treatment options for mild to moderate sleep apnea. Oral appliances, devices fitted by a dentist that reposition your jaw to keep the airway open. Positional therapy, sleeping on your side instead of your back. Weight loss, even a 10% reduction in body weight can significantly improve or resolve sleep apnea in overweight individuals. Surgery, in select cases where anatomical abnormalities are contributing. But for moderate to severe sleep apnea, CPAP is the most effective treatment. Before we wrap up, I want to address the question I know many of you are asking. If I've had this for years, have I already done permanent damage? The honest answer is that some damage from years of untreated sleep apnea may be irreversible, particularly if you've already had a stroke or developed heart failure. But the majority of the harmful effects can be stopped or significantly improved with treatment. Your blood pressure will improve, your stroke risk will decrease, your cognitive function can recover substantially, your quality of life will improve dramatically. It's never too late to get diagnosed and treated. Every night you use CPAP is a night your brain gets oxygen, your heart gets rest, and your body gets the restorative sleep it desperately needs. I've seen 75-year-old patients start CPAP therapy and tell me within 2 weeks that they feel better than they have in a decade, that they have energy again, that they can think clearly, that they feel like themselves. That can be you, but only if you take action. Now I need you to do something for me. Drop a comment right now and tell me, how many of these 8 warning signs do you have? Just a number, 0, 1, 2, or more. If this video gave you information that could genuinely save your life or improve your quality of life dramatically, hit that like button. Share this with someone you love, who's always tired, who snores, who's been told it's just aging. This could be the answer they need. And subscribe to this channel right now because next week I'm covering the 5 foods that worsen sleep apnea after 60 and what to eat instead. Nutrition plays a bigger role in airway health than most people realize. You'll want to catch that one. Until then, listen to your body. Don't dismiss chronic fatigue as normal. Advocate for yourself. Get evaluated. Your brain needs oxygen. Your heart needs rest. Your body is warning you. Please listen. I'm Dr. Scott Franklin. I'll see you in the next one.